Rabies is a fatal disease, but timely and appropriate rabies post-exposure prophylaxis or rabies PEP can prevent deaths due to rabies. In India, doctors and healthcare workers treat hundreds of patients every day in hospitals. Today is a usual day at the hospital, but the commotion here is at the anti-rabies OPD clinic where the patients with animal bite are waiting for treatment. Patients visit with different categories of animal bites, such as dogs, cats, monkeys, wild animals like fox and jackal bites in forest areas. Majority of the cases are due to dog bite. There are three categories of dog bite which have been classified on the basis of exposure. Category 1 consists of touching of feeding animals, licks of intact skin, contact of intact skin with secretions or excretions of rabid animal or human case. The category 2 of wounds consists of nibbling of uncovered skin, minor scratches or abrasions without bleeding. The category 3 exposure is single or multiple transdermal bites or scratches, licks on broken skin, contamination of mucous membrane with saliva from licks. In all the three categories of exposure, the first step is wound washing as part of wound management. The wound must be immediately washed up to 15 minutes with soap and water, or water alone if soap is not available to flush out the saliva. In case the victim reports late, the victim should not be deprived of benefits of wound management as long as the wound is unhealed. Disinfectants such as Providone iodine or antiseptic with virucidal activity should be applied. RABV enters the human body by a bite or scratch, so it's critical to get as much saliva and the virus out of the wounds as soon as possible. Ensure not to cause further damage while washing the wound. Let us look at a case study. Geeta is 60 years old and is bitten by a dog on her left arm. She claims she was attacked by a neighbor's dog while walking home.
कहाँ से कुत्ता ने काटा?
पड़ोसी कुत्ते ने काटा है।
पड़ोस का कुत्ता पालतू भी होता है तभी भी रेबीज हो जाता है। कुत्ता का वैक्सीनेशन हो रखा है, तभी भी हमें काटेगा तो तभी भी हमें वैक्सीन लगाना जरूरी होता है, नहीं तो रेबीज हो गया तो उसका इलाज ही नहीं होता।
The doctor examines her wound. Her wound falls in category 3 of rabies exposure. The nurse immediately starts PEP, the post-exposure prophylaxis treatment. First, her wound is cleansed for 15 minutes with soap and running water. After washing the wound, the nurse takes her to check her body weight. After calculating her body weight, the nurse carefully infiltrates rabies immunoglobulin or RIG into the depth of the wound and around the wound as much as anatomically possible. Evidence suggests that injecting the remaining RIG volume intramuscularly at a distance from the wound provides little or no additional protection against rabies as compared with infiltration of the wounds alone. RIG should be administered to all patients with category 3 exposure because it provides passive immunity in the form of ready-made antibodies before the victim can produce their own antibodies as a result of vaccination. RIG stops the growth of virus at the site of exposure and inhibits the virus attacking the nervous system of the body. There are two types of RIGs. HRIG or human immunoglobulin are of homologous origin and are relatively free of side effects. Another type of RIG is called equine rabies immunoglobulin or ERIG. It is of heterologous origin produced by hyperimmunization of horses. The dosage of HRIG is 20 international units per kg body weight, and for ERIG, it is 40 international units per kg body weight. Remember, RIG is administered only once, preferably as soon as possible. As per national guidelines, Geeta is also given an anti-rabies vaccine in both her arms. Geeta is still in pain and trauma due to sudden attack. Post the medical treatment, the nurse counsels her to reduce the emotional and physical stress and fully explains about the importance of timely completion of vaccination. Sometimes, in gruesome attacks, the dog bite is inflicted on sensitive areas such as close to eyes, ears, forehead or mouth, genitals, tips of toes and fingers, etc. In such complex cases, rabies immunoglobulin should be infiltrated carefully. Ensure not to put excessive pressure as it can cause compression syndrome. In case the wound requires suturing, then the rabies immunoglobulin should be allowed to diffuse through the tissues and suturing should be delayed for several hours. In case of additional small wounds which may be unreported, injection of the remaining RIG volume intramuscularly as close as possible to the presumed exposure site to the degree that is anatomically feasible is indicated. To prevent sepsis in the wounds, a suitable course of an antibiotic may be prescribed. Let us look at another case study. Sonakshi is here with her mother. She has a small dog bite on her left thigh. It seems like a nibble on the skin and is a superficial, non-bleeding scratch made by the dog. This type of exposure falls in category 2 for appropriate rabies treatment. This wound was already washed by her mother with water and soap. The doctor informs her mother that she will be vaccinated for rabies for precaution. As Sonakshi is still traumatized, the nurse is comforting her before injecting her the rabies vaccine in her upper arms as part of intradermal technique. The intradermal rabies vaccine must be administered through aseptic technique at deltoid muscle for both adults and children. Do not inject in the gluteal region. Vaccines may be inoculated in the anterolateral thigh for infants and small children. As per the intradermal or ID vaccination technique, safely reconstitute the vial of vaccine with the diluent supplied by the manufacturer. Draw 0.2 ml from a 1 ml unit syringe and carefully remove the air bubbles from the syringe, removing any dead space in the syringe. Stretch the skin's surface 1 inch above the deltoid muscle and insert the needle's bevel upwards. Almost parallel to it, slowly injecting half, that is 0.1 ml of the vaccine volume in the syringe into the uppermost dermal layer of skin. You may feel resistance while injecting the vaccination if the needle is correctly inserted inside the dermis. Immediately after the injection, a 3 to 4 mm raised bleb will form. Similarly, the remaining vaccine volume must be administered in the deltoid area on the other arm. Please note that the bleb will not emerge if the vaccination is injected too deeply into the skin. In this case, the needle should be withdrawn and reinserted at a different location, and the ID vaccine should be administered again. The National Rabies Control Program strongly advocates the use of the intradermal route of rabies vaccine over intramuscular route for various reasons. The ID route takes less amount of vaccine to complete the treatment. Since the ID route, all doses of vaccination can be done in one vial, whereas in the IM route, 5 vials are required to complete the vaccination, making intradermal cost-effective and equivalent immunogenic response as compared to intramuscular route. Victim is given 0.1 ml of 2 doses of vaccine on each arm through the ID route. Her mother carefully listens to the nurse, explaining to them the vaccination schedule. Healthcare providers are responsible for informing patients about the need of completing the vaccine dosage on time, both verbally and in writing. The rabies vaccine is given on days 0, 3, 7 and 28 by intradermal route. The first dose of rabies vaccination is given on day 0 to achieve effective immunity against the rabies virus. The vaccination schedule should be strictly followed. Sonakshi is in pain and crying. The nurse advises her mother not to rub the injection site, not to apply anything on it, She informs her mother that there may be tenderness at the injection site and a temporary rise in body temperature are possible side effects that do not require treatment. Now, let us look at a category 1's exposure case. Veer is attacked by a stray dog. The doctor examines him for any invasion or bites or scratches. His skin is undamaged, therefore his type of exposure comes under category 1. Usually in such situations, only washing of the exposed area with soap is recommended and no further treatment is necessary. The healthcare workers should be well versed with the management of 3 categories of wounds and complex cases. A quick recap. Category 1 wound consists of touching or feeding animals and licks on intact skin. Category 2 wounds consist of nibbling of uncovered skin, minor scratches or abrasion without bleeding, and Category 3 wounds consists of single or multiple transdermal bites or scratches, licks on broken skin and contamination of mucous membrane with saliva. In case of doubt, the treatment for the higher category of wound should be administered. The healthcare workers should also explain to the patients that they should not do certain things with the dog bite wound. The most important aspect: do not touch the wounds with bare hands. Do not apply irritants such as chilies, oil, turmeric, lime and salt. Storage and transportation of vaccine and RIG vials is a crucial aspect of rabies vaccination management. Since administration of RIG is mandatory in category 3 types of exposures, the vaccine vials come in lyophilized, meaning freeze-dried and in powder form. It should be kept at 2 to 8 degrees and should be kept out of direct sunlight. The cold chain from transportation and administration should not be broken to maintain the potency of vaccines. Adequate supply of suitable syringes should also be maintained. The medical staff should be well versed in the handling of open vials and proper vaccine storage protocols. During the storage or transit of vaccinations, temperature monitoring devices should be used. The vaccine vial should be stored at room temperature after reconstitution when using ID administration and can be put over an ice pack to maintain the temperature. The total content of the vial should be used as soon as possible and not later than 6 hours after reconstitution. Many questions arise when a person is bitten by an animal. What to do in case a patient misses scheduled doses?
The vaccination schedule does not have to be restarted after 1 or 2 days of deviation. If a patient misses 1 or more of the first 3 doses and does not return on the scheduled dates, additional doses should be administered to complete the vaccine and provide adequate immunity.
What should be the dosage of ID and IM route?
As per guidelines, 0.1 ml of vaccine per site and on 2 sites per visit should be administered on each of the day 0, 3, 7 and 28 through intradermal route. And if we want to give the intramuscular route, entire vial of vaccine is administered on each of the days 0, 3, 7, 14 and 28.
Is it alright to change the vaccine administration routes?
As a routine during post-exposure prophylaxis, changing the administration route from intramuscular to intradermal or vice versa is not recommended. Also, changing from one type of modern rabies vaccine to the other is not encouraged.
Is there any possibility of failure after PEP?
There are occasional human rabies cases reported despite post-exposure prophylaxis due to various factors related to negligence and individual health status. Most of the cases that has been reported due to delayed vaccination or non-use of rabies immunoglobulin in category 3 exposure, or it may also be due to incomplete course of vaccination. Some cases are related to immunocompromised status such as HIV/AIDS, cirrhosis of liver, or use of chloroquine, use of long-term steroids or anti-cancer drugs.
How should one dilute the vaccine?
The vial should be reconstituted as per the instructions on the vaccine vial.
National Center for Disease Control, NCDC, is implementing the National Rabies Control Program since the 12th 5-year plan with an objective to prevent deaths due to rabies in humans. As there is a global call for dog-mediated rabies elimination, the National Center for Disease Control, Ministry of Health and Family Welfare, and the Ministry of Fisheries, Animal Husbandry and Dairying has jointly launched National Action Plan for Dog-Mediated Rabies Elimination from India by 2030. NCDC has also formulated the national guidelines to bring out uniformity in the treatment of rabies and is constantly working to improve surveillance and raise knowledge about rabies amongst healthcare workers and the general public. It is the responsibility of the doctors and healthcare workers to make the animal bite victims understand the importance of timely treatment and complete vaccination, as rabies is a fatal disease. This will make India fulfill its mission to eliminate rabies by 2030.